Nurses of Reddit, what is the most haunting last words patients have said to you? Now, for the first comment. My mom was sent home from the hospital because she was nearing the end and wanted to be home. The last few days she was heavily medicated and didn't really communicate at all. On Sunday she took off her oxygen mask and said she was going to die tomorrow. She put her mask back on and didn't talk anymore. I called out of work. That was an odd call to make, and called the family. Her twin drove 4 hours to be there on Monday. She died Monday evening with her whole family at her side. It has been 4 years and it still weirds me out. Next comment. When I was 19 I was working in a lab at a hospital as a phleb and I was really good at drawing blood. Was called to to draw blood from a 12-year-old at around 7 amateur. He had spider web-looking veins all over his body except hands, feet, and above the neck. Drew blood. No big deal. Called back again to draw a second sample. Everything was purple. He looked up at me and asked me if he could have some water. I looked at the attending and he shook his head, no, and then mouthed, "We're about intubate." He grabs my hand and 2 seconds later he went into arrest. His parents were outside the room looking in through glass. Mom was bawling. Dad was bawling. Everyone did chest compressions for what seemed like 45 minutes. He died. Last thing he said to anyone was to ask for some water from me. I left, kept my composure, got to a private hallway and started bawling. Entire way back to our office. Walked into my boss's office and said, "I quit." Turns out kid had bacterial meningitis. Next comment. Not a nurse but the last words my mother told me before she died was, "I feel a lot better." She had been battling breast cancer and doing chemotherapy the last couple months. Still makes me cry. Next comment. Not a nurse but I'm a therapist at a hospital. Had a patient basically in his end stage of life tell me, "I can't even spend my own money." Not sure why this hit me so hard but it stuck with me. Next comment. After Dad graduated medical school he was a resident in an inner-city emergency department. One night rescue brought in a guy the department knew of. Major health issues, major addiction issues, and a real scumbag to boot. When rescue found him he'd been laying in his own filth for days. His chest x-ray was lit up like a Christmas tree, with pneumonia, as my dad tells it. His heart was in even worse shape. Even while laid up in bed this guy still found time to harass the nurses. Throw out every name in the book. Real nice dude. So my dad was at the nurse's station when he notices an irregular rhythm on this guy's heart monitor. When Dad tells it he likes to make a repeating M shape with his finger. He was going into ventricular tachycardia. Not a great sign. So he headed over. My dad stood in the doorway and asked, "Hey buddy, how do you feel?" Quote. And the guy looked him in the face and yelled, "With my hands, you jerk off." Quote. And then he died. Next comment. Not a nurse but we had a guy who was in a major MVA. His left arm was severed above the elbow and he was circling the drain. His blood pressure was tanking. Pulse was starting to fade and he asked me about his dog that had been in the vehicle with him. Asked me if his dog was okay. I didn't really answer him, as the dog was dead and I didn't want to put him in any more distress than he was already in. We landed a helicopter and I shit you not we were about 30 seconds from loading him into the helicopter when he coded. If you know anything about traumatic CPRs there is virtually no chance that they will survive. Especially without deficits. Maybe like a 1 to 2% chance, I can't remember the exact number. Anyway we worked him, got him loaded back into the ambulance and made the 35-minute plus transport to the trauma center. Through rush hour traffic, got him into the trauma bay. The doctor said they were going to do one more round and if there was no improvement they were going to call it, which they did. So the last thing the guy said was, "Make sure my dog's okay." Ultimately he died from internal hemorrhaging, which there's nothing we could really do in the pre-hospital setting for him. If we had TXA or something like that we could have used it, but it's a toss-up whether it would have helped this guy at the point he was at. Next comment. I don't want it to die. Looking straight at me as blood poured out of their mouth from esophageal varices that had ruptured, a literal death sentence. As the patient knew well, I still remember the color of their eyes. Next comment. Not a nurse but had a kid who was just standing on a sidewalk in a bad neighborhood. Drive-by shooting which of course missed their target and hit this kid and an older gentleman. Older guy was DOA, kid got hit in the arm once and chest twice, barely clinging to life. Only thing we ever heard him say before he went unconscious was how much pain he was in and that he didn't want to die, which a few minutes later happened. I've never worked so hard on a PT before or since. Partner quit the next day and I'm still going 13 years later. Next comment. I worked as a CNA in a nursing home for 2 years when I was in nursing school. We had patients on hospice frequently, most of them at the end just peacefully slipped away. We had one gentleman who was always just, if he wasn't trying to grab at my behind, he was yelling at me over something I couldn't help. Like the lights in the hallway or his roommate snoring. He used to change his TV every time I came in his room so we could watch Shark Week and trashy reality shows. He got a very bad diagnosis and went downhill really fast over the course of a week or so. And we called his family. They were on their way but they wouldn't be there for a while, so I stayed with him the first night. That we all kind of knew he didn't have much longer. He was panicking. He wouldn't settle down. He kept saying, "Help me," and there was nothing I could do. I just held his hand and told him over and over he wasn't alone. He was like that for 2 or 3 days before he slipped into a coma. It still breaks my heart. I think about him looking at me that way and frantically asking for help. Then telling me he loved me. Then asking for help again. I wish there was something I could have done. I've seen death plenty of times, but I've never seen that before or since. I hope I never have to. Next comment. A few years ago my best friend lost her fight with cancer. Her mother had also died of cancer when my friend was 21. I helped care for my friend right to the end so she could be home instead of in hospital or hospice. And I was there when she died. About an hour or 2 before that, she started getting very agitated and asking for some very specific things. Some buttons of a certain color. A particular item of clothing. A few other things. Her sister realized that she was asking for things her mother had been wearing or had in the room when she died and got very upset and told her that she didn't need them. It was okay without them this year. My friend looked at her and said, "Don't worry, Mom's telling me how to die." She was seeing her long-deceased mother and thought she needed the same setting before she could die. I assumed that it was a hallucination. She'd been having them for a couple of days at that point after her pain meds were increased. But it was very unnerving to witness and seemed different to the other hallucinations she'd been having. Maybe she really did see her mother. That moment certainly brought me closer to believing there might be an afterlife than religion ever did. Next comment. Had an elderly woman who was intubated and sedated. When you have a patient who is sedated, you turn down their sedation and try to wake them up. Kind of. Every morning to test their readiness to come off the ventilator. She never really woke up. Her adult son was distraught. He was her next of kin, and he had to decide if he was going to take her off the ventilator or keep trying. He had agreed to take her off the vent the next day. I was in her room later that day, and I was chatting with her like she could hear me. When suddenly, she responded. She made a purposeful nod. I was startled to say the least. I took her hand and tried to figure out how to explain to her what was happening. She was dying of cancer. She was failing her weans. And we planned to take her off the vent tomorrow to die with her son by her side. And I asked, "Is that okay?" Quote. She nodded. Do you want me to call your son and tell you that you love him? Quote. She nodded. I wish I could remember what we talked about next. Did I pray with her? Did I comfort her? I don't remember. But I do remember calling her son and telling him that his mom knew she was ready, and that she loved him as your. Next comment. Not a human nurse, but I once worked as a vet's assistant. I hope it's okay that I am writing this here. This memory still haunts me, and it's the reason why I changed jobs, because I couldn't bear it anymore. We needed to euthanize a very sick and old poodle. He was the poodle of a very old lady. She held my hand, cried, and asked me, "Why can't you euthanize me too? I have no one. My husband died before me. My child died before me. And now my dog. I have absolutely no one. I just want to die. Why can't I get euthanized too? I don't want to live anymore. Please." That's over 10 years ago, but it still makes me cry. And I know it's necessary to put animals to sleep when they are suffering and can't be saved. But it was too hard for me. I was an emotional mess after working in the vet practice. I can't even imagine working as a nurse, or working in a children's hospital. I am too sensitive. Thanks for watching. Please subscribe and like the video if you enjoyed.